This is an example of patellar clunk syndrome. Patellar clunk is an infrequent cause of pain and catching following a full knee replacement. It is caused by the formation of scar tissue inside the joint where the quadriceps tendon inserts on the patella. You can see here the yellowish fibrous tissue getting caught between the white plastic liner on the patella and the silver metal femoral component. As the knee is flexed and extended, that scar tissue can catch on the knee replacement, typically around 40 degrees of flexion, causing pain with a grinding or popping sensation. An arthroscopic debridement can be a good option to treat this condition in a minimally invasive fashion. An arthroscopic shaver is used to remove that extra scar tissue. A couple small portal sites may be used to ensure that the entire area is cleaned up. Once the fibrous scar is removed, the knee moves smoothly without catching or pain.